Hi, I am Dr. Roopa Rajan, Additional Professor of Neurology and Movement Disorder Neurologist at All India Institute of Medical Sciences, New Delhi. On this World Parkinson's Disease Awareness Day, it is my pleasure to discuss Parkinson's disease with you. What is Parkinson's disease? Parkinson's disease is a neurodegenerative disorder of the brain cells. I like to think of it as something similar to diabetes that you may be familiar with. In diabetes, there are certain cells in our body that produce a hormone called insulin, which reduce in number, and the deficiency of which results in the symptoms of raised blood sugar. Similarly, in the brain, there are some specialized neurons or nerve cells in the part of the brain called substantia nigra, which slowly reduce in number in Parkinson's disease, which result in a deficiency of a neurotransmitter molecule called dopamine. And this results in several of the symptoms that we know to be associated with Parkinson's disease. The symptoms of Parkinson's disease include motor symptoms like tremor, slowness, stiffness, difficulty in walking, and along with that, a host of non-motor symptoms like low mood, sleep disturbances, memory issues, bladder disturbances, etc. So, what can we do to stop the progression or prevent the progression of Parkinson's disease? As of now, there is no treatment or medication or strategy that is known to halt the progression of this disease. But we definitely do know that people who are physically and cognitively active, especially those who are physically active, the rate of progression is slightly lower in them, especially when you talk about things like walking difficulty or memory problems. These tend to occur at a lesser rate in people who are physically and mentally active. So therefore, please if you are living with Parkinson's disease, please include good physical activity, aerobic exercises, goal-directed aerobic activity as part of your daily routine. Very common question that I often get asked by patients is, when should we consider deep brain stimulation surgery? How do we decide if you are a good candidate or not? So deep brain stimulation is an advanced neurosurgical treatment to insert a pacemaker into the brain cells and stimulate these cells by delivering current from an implanted pacemaker. And this process helps to control the motor symptoms of Parkinson's disease. Whether it is the right strategy for you has to be decided by a multidisciplinary team comprising of your movement disorder neurologist, the neurosurgeon, perhaps the neuropsychiatrist, and the physical therapy specialist. So there are a set of things that we look for, whether you have Parkinson's disease of sufficient severity. Generally, if you are taking medications more than 5 times a day, still experience motor fluctuations or off times or abnormal unwanted movements, this may be the time to consider surgery. And it is best done in people who are in the mid stages of Parkinson's disease, before the advanced symptoms of memory and gait dysfunction set in. And also, one has to make sure that any controllable factors like mood issues or any hallucinations, these should be taken care of for the best outcome after DBS surgery. If you are someone living with Parkinson's disease, or you know somebody who lives with Parkinson's disease, it may be time to discuss all these therapeutic options with your treatment provider, and if suitable for you, do not hesitate to say yes to DBS.
Say yes to DBS.